Hello, everyone. It's Thursday, June the 11th. This is our briefing today. We've got the very best news that we can start out with is we have no additional deaths in West Virginia today. We have 85 total. I remind all of us to keep all those people that we've lost, great West Virginians, in your thoughts, your prayers. And I'm very, very hopeful we can string together some days that we don't have to come out here and announce that we've lost another West Virginian. But I congratulate you again and again and again, West Virginia. You've done really great. Your numbers are unbelievable, but the numbers really don't matter when you think about those 85. So always remember those 85 and think about them in your thoughts and your prayers. This is week 7 of our West Virginia Strong, the comeback. Reopening plan, the guidances and everything for the businesses are all available on our website. Remember all those. I've got some announcements. I'm going to start off with just this. Yesterday, our board of directors at the West Virginia Board of Directors of the State Fair of West Virginia, the board of directors voted to move forward with having the State Fair in West Virginia. And I congratulate our director, Kelly Collins. Kelly played basketball for me a long time ago. She's a beautiful young lady, and she's doing a phenomenal job, and a phenomenal job on the national level as well as the state level. So we're super proud of Kelly and all that she's doing, and we congratulate the State Fair in their decisions to move forward. I'm sure, they're going to abide by very strict guidelines and everything, but yet the fair is so meaningful and so meaningful to so many. I especially encourage all of you that don't know all the fabulous things that go on at the fair to go. I mean, the State Fair is a phenomenal event, and it's a celebration of West Virginia. So as well as our other fairs and festivals, support them, be smart, wear your mask, if you choose to do so and everything, stay a social distance and everything. And absolutely, I would highly encourage you to go to the State Fair. The other thing I would really encourage you to do is just this. Through 4-H and whatever, you've got all kinds of kids that are, 8 years old or whatever, all the way up through high school, or maybe even a little after high school. But what they do is they raise their show animals, and then they show them. And then at the event at the State Fair, they sell those animals, and it is a fundraising effort for those kids. Many of those kids use those dollars to pay for their college education as they go through, because every year they're basically taking an animal and bringing it and showing it and everything, and then moving on to something else. But they show their pigs, their hogs, their goats, their sheep, and their cattle, and it is. It's really, really amazing what they do. Those kids work really, really, really hard, and all the people that are there supporting them and helping them and everything. And so, like I said, if you could show up there and bid on their animals, they have a live auction and everything. It's exciting for those kids, and those kids need your support, and they come from all over the state. I had the opportunity to be there an awful lot and everything, way before I took this job as a governor, or was honored by, you putting me in this job. So with all that being said, think about those kids, think about, this great event and everything, and it tickles me to see that the board decided to move forward, and I'm sure they'll do it in a safe manner, and it's a big event for West Virginia. It's from August the 13th to the 22nd, and so, go to the State Fair. It's a good thing. I want to read to you this, and this is in regard to our state employees, but I am proud through this pandemic that our state government has continued to function and serve West Virginians as well as they have done with this very, very, very essential service. Many, many people have worked from home and they have done terrific work. I don't think we've hardly skipped a beat. And so I congratulate all those state employees for all the great work that they've done. And as we transition back to work, we're still going to have people that are, that will have the flexibility through our cabinet secretaries to be able to telework and work in that manner. And we're going to rely heavily on our National Guard to make sure that our buildings are cleaned and done in a way that makes us absolutely the safest that we can possibly be. And today we are sending additional guidelines for the safely reopening of our state government buildings back to our cabinet secretaries and those other constitutional offices that use our state buildings. And I want our state workers to know that their safety is paramount and of our highest concern, and we will do a terrific job in assuring that. So as state government begins to open up more and more and more, we just want to let everyone know that our people have done a terrific job. They've kept us running in the most essential way. They've kept our government up and going, and we congratulate them on that. As we bring them back, we just want them to feel like we're bringing them back in a very, very safe atmosphere. And so we look to have them back, and that we'll be moving forward on that. Now, gosh, it's always amazing to me, how many things that we have to report to you, and I try to go through them as quickly as I possibly can, as respectfully as I possibly can. But let's go back to our nursing home visitation. As I announced yesterday, guidelines are now available on my website, that will allow limited visitation to our nursing homes beginning the 17th on next Wednesday. I want to just say this too. I think that we have in place, now I need to double check this, but yesterday we were contacted by a lady that her mom is in bad shape and she's probably going to pass away. And this lady felt like that was a real emergency. And I think that we already have in place situations just to take care of just that. So I'll double check it, but I would really urge our nursing homes to try to find a way, if in fact, we have an imminent situation. We sure don't want to wait till the 17th to be able to take care of a very, very imminent situation in which we don't want to lose this person and waiting on the 17th date. So, I think the biggest thing is just this: we can do it now. If it is a case that is from a standpoint of real compassion and everything, and so try to work in every way to achieve just that, because gracious sakes, we don't need to wait around for a specific date if we have an imminent situation like that. As far as our schools, I congratulate Clayton Birch. Clayton is now officially our permanent West Virginia Superintendent of Schools. It is very deserving. He is doing a terrific job, and I'm really, really proud of him. Dr. Payne did a great job, and because of some medical situations, primarily with his wife, he had to leave, and we totally understand that. We'll always support Dr. Payne, but Clayton Birch is knocking it out of the park, and he's really on his game, and I congratulate Clayton, and I have full confidence that he'll lead us in that very, very, very important department, maybe none more important. And so, Clayton, again, congratulations. Back to all of our cities and our counties, we're up to 49 applications now. They continue to come in, and they come in quickly. And like I've promised before, we're going to be pumping out lots and lots and lots of money, and we're going to pump it out very, very quickly. And so get those applications in. We had a question yesterday in regard to the volunteer fire departments, and I want all of our volunteer fire departments to know just this, that I want to make it clear that we have no restrictions on our volunteer fire department's ability to raise money. Now, you have to do it in a socially distanced, you have to do it in a safe manner, and I know you'll do that. You know how to do this, and I encourage you to try to fundraise, but more importantly than anything, I encourage our people to just know how important our volunteer fire departments are. For crying out loud, you can find a way, West Virginia, to support these great organizations and the need that all of us have for them. So you talk about an area that we need to step up to the plate. Our volunteer fire departments and everything, please, West Virginia, search your heart and everything, and if you can find a way to donate or help or come to some fundraising event or just to send a check of your support, to a fundraising event for a volunteer fire department, do so, please. Really, really good stuff. And we continue to search ways and from the federal government and all that that could positively impact organizations such as this. And while I'm on that, I just want to touch on this just a second. I just checked coming in the door and everything. Stock market is down 1,300 points today, which is not good and everything. It's not good in lots of ways, but it is sending this message to us. The stock market always is somewhat of an indicator of how things are going to be, how things are going to be in the future. Well, I really believe that things in the future are going to be good. But I want you to just know, what is the market telling us? The market's telling us this: we got to have another stimulus package. There'll be another stimulus package. And the guidelines for that additional stimulus package will give us the abilities to do more things than we're able to do today. And the market today is telling us, saying, look, America, you've done really good. You've done really, really good. We could have cratered into a hopeless depression, but you have done really good, America. And our president has done really good. Now, with all that being said, America, you're still wounded and you're still hurt, and going forward, you've got to still have additional help from the mothership, and that's the federal government. So at the end of the day, there's going to be additional stimuluses coming, and that is what I think. Now, to be perfectly honest, maybe that and 50 cents will buy you a cup of coffee somewhere, but I really, truly believe that that's what's going to happen. And so from the standpoint of our businesses, that are still struggling in every way, I think there's more help coming. And I know that there's going to be some level of help coming from the state government, but we can't help enough from the state government. We've got to have the mothership, and that's the federal government. And so from the standpoint of all the different things, from an additional stimulus package to the easing of the guidelines to a federal infrastructure program, to all those things, I still believe those will be coming. Now, and so we surely don't celebrate the stock market being down to the level that it's down in any way, because a lot of 401ks, a lot of stuff are getting really hurt and everything, and we were really happy to see the big run up and all that, but at the same time, I think the market is just telling us just this: we're not strong enough yet to move forward out of this terrible pandemic, and there's probably a lot of small businesses that are out there that are still hurting, and I think the market recognizes it, and I think there'll be additional stimulus coming. Okay, I've just got a few more announcements. I'm going to go as quickly as I possibly can. Our free testing for minorities and the most vulnerable people is still continuing to go on. I remind you that Friday and Saturday, June the 12th and the 13th, will be in Greenbrier, Hancock, Logan, and Wood counties. On Saturday the 13th, we'll be in Grant and Hampshire and Hardy counties. Go get tested. The more we're tested, the better we'll be. I just got off the phone, 2 different calls with Clay Marsh. Clay Marsh is such a superstar. It is amazing. I mean, he's just unbelievable. But over and over and over, Clay says one thing: the more we test, the more information we have. The more we test, the more knowledge we have. The more we test, absolutely, the better we can be to protect you. And so go get tested. Please do that. On a jails update, we're still on track to complete everything on June the 12th with all of our additional testing. There are now a total of 9 active COVID-19 cases at 5 jails and 2 prisons. Now, the great part about that is this: we hoped there was 0, but we've tested now in excess of 9,000 inmates and employees at those institutions. What we have been able to do is isolate individuals that could have contaminated many. Now, we were really blessed for a long time to go 0, 0, 0, 0 in our testing. And now, as we've gotten more testing capabilities and everything, we're able to do more and do more. Again, I congratulate all those in corrections for protecting these people, and the fact that we've not had a single death, in regard to this terrible killer, and so good stuff. Let's just keep doing it. On our summer feeding program, I want to remind everybody, the map's up there. I think we have 670 sites. If you don't know where to go, call 211, and you'll be assisted in where you can go and pick up food. And we absolutely want to try to continue to feed everybody we possibly can, and we want no West Virginians going hungry. So please take advantage of that if you can. I want to commend the National Alcohol Beverage Control Association. They stepped forward and donated $10,000 and donated it to the Mountaineer Food Bank on the behalf of West Virginia Alcohol Beverage Control Administration, and I want to especially thank them and thank our commissioner, Fred Wooten, for the work that they're doing and all the good stuff that's going on. And Fred, I haven't seen you in a while and everything, but I hope and pray you're doing great, and congratulate your brother on his Supreme Court win. And so anyway, I'll be talking soon, but keep doing great work, and we appreciate you supporting our food banks and doing the work that you do every day. I want to remind everybody again, last thing about the census, and I also want to tell you, as I've already told you, but as we go forward, if we continue to pump out the numbers that we're pumping out right now, I think what we'll do is next week we we're going to go on a schedule of Monday, Wednesday, Thursday in doing our briefings. We would have gone, we missed one day this week. I think we can start easing back to 2 days where we do 3 days during the week and we do 2 days off. I think it'll be more meaningful to the people that are looking in, and as well as the media and all the people that are covering and handling all this. The reason we're going Monday, Wednesday, Thursday is I have a previous engagement on Friday, and I surely want to be here with you. If that engagement changes, we'll go Monday, Wednesday, Friday. But nevertheless, I will right now plan on Monday, Wednesday, and Thursday of next week. Okay, the last thing I want to go to is our charts. I do this real quickly, and you'll see on the top line, the 2 lines continue to separate. We're 1,516 people that now have recovered, and 611 that are active cases. All that's good stuff, great stuff. On our daily percent of positives on the number of tests we had yesterday, we bumped up just a little teeny bit to 2.04, still really good. we're trending below 1%, and all that's really good. Now our total cumulative in the bottom, you can see it just keeps going down and down and everything. These are the numbers that we want. Now we're at an all-time record of 1.83%. It's phenomenal. It's absolutely just knocking it out of the park. And as long as we continue to do that, we're going to be able to continue to have things like our state fair and all the stuff that we announce each and every day. Please, West Virginia, watch one thing, and then I'm through. Watch just one thing. In Arizona, in Florida, in Texas, in North Carolina, there are issues today. Because our numbers are phenomenal doesn't mean that there can't be issues tomorrow in West Virginia. It's all up to you. It's all up to you, West Virginia. Absolutely, without any doubt, you want to be reopened. I want you to be reopened. I want you to get back to your lives as close to normal as you possibly can. I want you to be able to support those kids that are showing their animals at the state fair. Absolutely, West Virginia, I want your lives to be back. I want to keep you safe. But I got to have you. I got to have you every way. That's all there is to it. Just be smart. Just continue to show the world the miracle that's happened in West Virginia. The numbers continue to be great and even greater. But absolutely, it's all up to you. Wear your mask when you go outside as best you possibly can. Protect yourself. If you protect yourself, you'll protect others. Just keep doing it, West Virginia. Really, really proud of you. That's all I got today. Thank you.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon. I have just a few things I'd like to share. First of all, is just to reinforce what the governor just finished saying, that we know that 19 states are seeing an increase in the number of COVID cases. 9 states of those 19 have seen an increase in the number of hospitalizations. One state, Arizona, has activated their emergency response plan because they see over 75% of their ventilator beds taken up now, and so they're worried about the surge. And although we have been very much on top of our game and have not seen a surge on the first time with the COVID pandemic, that we know today, as we come back out again, that we, like every other state, is at risk of seeing that spread increase. And to that end, I want to let people know that we continue to follow some of these vital statistics, these numbers, as the governor said, and we are following the reproduction rate, what we've talked about, the R naught, which is a number that we're following. When we look at the national assessment, we're at 0.89, which is trending in the right direction. When we look at our own internal assessment, that we're even better. We're about 0.6 or so. Part of the issue, though, instead of looking today at the state as just a single whole, we're starting to look at the state as counties and areas. And what we're starting to see is there's certain areas that have an increase in their R values. And as we see those R values go up, certainly working with DHHR, with Secretary Crouch and Commissioner Slimp and Deputy Secretary Samples, we are now starting to look at targeting some of the assessment, working with local health departments and county health officers to try to do more testing in some of these areas. And certainly as we've said, we've looked at areas at risk nationally, nursing homes, congregate settings like corrections facilities, certainly with vulnerable populations like the African American population and others. But today we're seeing that there is a creeping up of that R reproductive value in our southern counties. And so we really want to increase testing there just to sample and understand what's going on. As we've talked about, the number of people that can spread very rapidly is small, the super spreaders. So we want to make sure that we are assessing these areas, biopsying in some ways, just to sample to see what's going on in those areas. And if we find people that are positive, then we want to make sure that we are identifying them and doing that very effective and rapid case investigation and contact tracing, which our public health people are doing a great job of. Now, one thing that came up this morning when it came to testing is how should we be testing? And some people have communicated that they believe that doing the very deep nasopharyngeal swabs are a much preferred way to test versus the very much shorter nasal swabs. But it turns out that they're both actually equally as good and effective. If you have COVID infection, we will pick it up via both ways. And in fact, that nasal sampling with the shorter swab is much, much more comfortable. And so if we ask you to test multiple times, then certainly that's going to be a much more desirable way to test. And as we go forward, these are the kind of tests that will be perhaps available someday in your own home or in your pharmacy or locally without having the medical people so deeply involved. So we would encourage you to feel very safe and comfortable being tested by this nasal swab approach versus the very deep nasopharyngeal swab, because they are equal in the eyes of all of our governing bodies, including the Centers for Disease Control, the Federal Drug Administration, and others. So I agree with the governor. My final plea to you, though, is there's a new article that came out in Lancet, which is the most sophisticated assessment of all the studies that have been done around spread of coronaviruses, SARS, MERS. SARS is the virus that happened before the COVID. MERS is a second infection that happened in Asia and some of the Middle Eastern countries. That's another type of coronavirus, and then COVID. And the study, which was actually done by the World Health Organization, that's had some different thoughts about masks and all this, basically found that masks were very, very important to reduce viral spread, as is distancing. And the more you distance, the better the impact you get. But as we've said, 6 feet of distancing is very protective. With a mask, even more protective. And they added that wearing eyewear to protect your eyes is perhaps important as well, and reinforce the idea about washing your hands and keeping your hands clean. As we've said, in countries that do this, there's been very, very much reduced death from COVID infection. And certainly we are so proud of you, West Virginia, but want to make sure that we're all safe and we protect each other and we protect our great state as this goes forward.
Thank you, Dr. Marsh. Once again, we're holding today's briefing with media members joining us virtually to practice good social distancing. Also want to point out that Major General Hoyer from the West Virginia National Guard and Secretary Bill Crouch and Dr. Kathy Slimp are joining us virtually and are available for questions. The first questioner we have today is Charles Young with WV News.
Hi, Governor. This is Charles Young with WV News. I wanted to go back to you encouraging folks to go to the state fair. I know it was just a couple weeks ago, there was some concern raised about a livestock auction that had, 700 people at it. The state fair usually draws thousands of people at a time. Could you talk about kind of squaring those two things? I would imagine that if we have all these people congregate, it's going to lead to an uptick.
Right, Charles. The whole key to everything is social distancing. That's the whole key. When it really boiled down to it, and I don't think it was the Jackson County livestock auction, but it was in Jackson County, and there was a building, a relatively small building, and people were really jammed into the building. 700 or so people into that building. I'm sure that the state fair is going to have guidelines all set as we're going to give them. That basically is going to enable those kids to have their livestock auction or whatever like that. It's a pretty good sized building, but we're not going to be able to have, 700 or 1,000 people jammed into that building where, and everybody is just going to have to just do this. just look out after yourself as best you can. Abide by the guidelines and social distance and everything. And I'm sure the guidelines we're giving and that the state fair is giving are going to be the very best that we can possibly do. You know, it's not perfect. We know it's not perfect. You know, if we wanted it to be as perfect as we could be, then what we'd all do is lock ourselves down and all stay at the house. You know, and that way it would be better, but it still wouldn't be perfect even in that way. And so with all that being said, we're reopening, we're watching the numbers like a hawk every single minute and everything. And the numbers tell us we can continue to move forward. And so as we're there, you know, the social distancing is the whole key.
Thank you, Charles. Next, we'll go to Steve Adams with Ogden Newspapers.
Steve Adams with Ogden Newspapers here. I didn't hear a timetable for when state employees would be allowed to start heading back into state offices. Obviously you're putting out the guidance for cabinet secretaries and whatnot. When are we looking at for that to start happening? Next week? What's the timetable? Thank you.
I think this is all tied to our cabinet secretaries, and they bring them back. They're bringing them back as they need to and everything. They're teleworking as they can do, and what we're doing is just making sure that the buildings are absolutely as safe as they can possibly be. All kinds of guidelines will be in place for our secretaries to be able to bring people back, and we'll leave an awful lot of that to our cabinet secretaries.
Thank you, Steve. Next, we'll go to Amanda Barron with WSAZ.
Hi, everyone. Amanda Barron with WSAZ. I know that we're still at the very beginning of this reopening and things like that, but I got a question from a restaurant owner wanting to know when or how they'll know when it's okay for their employees not to wear masks. Some of their work is outside, as you know, with outdoor dining. It's hot, it's stuffy, and they're just wondering, you know, when will that end, or when will they know? Will they get a directive from you?
Amanda, I think I can answer it because I can answer it quickly and everything. It'll all depend on our experts. Our experts are advising us nonstop as to what to do in regard to our restaurants, because we're relatively close together there. And, you know, the people that are working in the restaurants, you know, are right on us as far as taking your orders and doing the things that they're doing. So again, I know, I get it. I get it from the economic standpoint. I get it from the inconvenience standpoint, and I get it. But I caution everyone just this and everything. Saving an additional life. Just think about the level of inconvenience that we're suffering through if we can just take one step to just stay cautious, crawl before we run, and just cautious in what we do. We're trying to turn you loose as best we can possibly turn you loose, but let's just try to be as cautious as we can.
All right, thank you, Amanda. Next, we'll go to Mark Curtis with Nexstar Media.
Governor, good afternoon, Governor, and everyone else. I know you mentioned the need for another stimulus package and your expectation one would be coming from Washington. This morning at a press briefing, Senator Manchin expressed some concerns about one aspect of that, and that's the possible extension of the extra $600 per week in unemployment benefits. He's hearing, and we're hearing, that a lot of employees aren't going back to work because they can make more by keeping that $600 every week. This is especially true for restaurant employees. Then go back to the job. So would you favor keeping that $600 a week extension, or is that something that should be looked at if it's really causing people not to go back to work?
Well, Mark, I don't dodge any question, but in this situation, really and truly, that's not going to be in my pay grade. At the end of the day, that's going to be a decision that's going to be, it's going to be decided on the federal level. It's absolutely, you're exactly right in the fact that there are people that are out there that are getting at $600, and it's more money for them to not work than to go to work, But I would encourage everybody just this. We don't need to try to beat the system. At the end of the day, our federal government is stepping up in every way to help you and to bridge you. And we're trying, and America is being at its best today. So is the state, and so am I, and we're being at our very best. And so I would encourage you in every way to go back to work, but at the same time, I don't know the specifics of what's going on in your household and everything else like that. And so all I can say is, I am sympathetic to everybody's situation, but at the same time, we don't need to be trying to beat the system and everything. And from the standpoint of, the way our federal government's handling this, I surely understand the concerns and the issues, but we need to get back to work.
All right, thank you, Mark. Next, we'll go to Glennis Board with West Virginia Public Broadcasting.
Hi, good afternoon, Glennis Board with West Virginia Public Broadcasting. Governor, I'm curious about ongoing protests. Given the pandemic, are you prepared to take any additional actions, or have you already taken any additional actions to address people meeting in public here in West Virginia or outside of the state?
Okay, now somebody help me, because it was really muffled, but somebody help me with the question.
Repeat.
First, people are what?
Meeting, like the protesters are meeting, like are we going to take any other action?
Was the question, are we prepared to take additional action because of people, expressing their right of freedom of speech and protesting and not following guidelines or whatever? Was that the question?
Yeah, I'm curious to know if there have been any additional steps taken, or if you're curious, or if you've taken any steps outside of the state as well to address protesting in the pandemic.
Well, there's absolutely been no additional steps that have been taken as far as restricting people to express their views and their frustration and their right to freedom of speech. There's absolutely not been anything. In fact, I encourage in every way, because it really moves people, and it makes us think of better ways. But from the standpoint of the only thing I would say to you is freedom of speech. Is freedom of speech essential? You're dadgum right. You're dadgum right, it's essential. And so from that standpoint, the guidelines go away in a lot of ways when we call it essential, and absolutely freedom of speech is essential. And so, now beyond that, I would encourage all those that are involved in whatever the protest may be, or the meeting or whatever like that, social distance, just be smart, and protect yourself and as very best you possibly can.
Thank you, Glennis. Next, we'll go to Brad McElhenney with West Virginia Metro News.
Hi, Governor. Hi, everyone. We know a little more about the recommendations to the state school board now. Sounds like it may be earlier than normal. Also sounds like it might not be 5 days a week. I wondered your impressions about how school may take shape next fall.
Okay, normally I don't answer this many questions, but I'm going to continue to go. Brad, first and foremost, those people at our state Department of Ed and all the county superintendents and all the people that are involved in education, they're doing a heck of a job. They're really doing a heck of a job, and they're going to protect our teachers. They're going to protect our kids, and from the standpoint of relying on and deferring to the experts, well, that's what I'm going to do, and from the standpoint of how's school going to look, is it going to be a little different and everything else? Well, sure, it's probably going to be a little different, but remember just this, that's still a long ways away. And I've said over and over, the situation is fluid, it changes, and it changes all the time. And so, Clayton works hand in hand with our DHHR. All the people are working on it, from the experts, and And so I would just tell you just this, that this is the first blush at what we need to do. If things change to the bad side, you can bet that things were going to have to be tightened up an awful lot. If things change to where we have a vaccine or a drug, you know, we'll all be celebrating and we'll all be back to normal. So you know, I commend them on what they're doing so far. So far, it looks good to me, and we'll just keep moving north.
Thank you, Brad. Next, we'll go to Taylor Stuck with the Herald-Dispatch.
Hi all, it's Taylor with the Herald-Dispatch. With reproduction spreading in the southern counties, have you put any more thought into maybe mandating masks to be worn, maybe just in specific areas? And what would be kind of the kicking off point? What would signal to you that that would be something that you would be willing to do if you did mandate masks?
Okay, Taylor, I'm going to let Dr. Marsh answer this in the beginning. And Doc, if you could weigh in, or Dr. Slimp, you know, maybe even Bill Crouch. I'll come back in on the tail end of it, but go ahead.
So maybe I'll start and then I'll hand off the question. So it's an important question. And as we are moving forward, you know, as we've said, we want everybody to stay together. So really understanding better, you know, what is the depth of any potential problem, and this reproductive value is a very early sign that maybe things are changing some. And so instead of us, you know, hitting the fire alarm, we are really now, you know, in working with Dr. Slimp and Secretary Crouch and our local health departments, trying to use these early signs so that we can then go and try to understand, you know, what is really the issue. Certainly when it comes to mandating masks or other things, as the governor, I think, has said very consistently, we are really here to advise and to encourage, you know, in any way we can for people to protect themselves, which protects them and protects their families and the vulnerable people of the state, our healthcare workers, and our state. But what we don't want to do is throw a divide in the middle of our state and have people line up on one side or the other side, because the most important parameter to me for the outcomes that we have experienced and had in the state is really the togetherness and the connection of our citizens, the community that is great in this state. And I think that people will always do the right thing. And we just want to help advise them and understand so that we can give them guidance so that they will be safe and protect other people in their communities. The only other thing I would say, in the southern part of the state, if we overlay a map of the health sort of issues and problems, chronic health diseases, some of our age of our citizenry, we see that this is also a vulnerable part of our state. And so we want to make sure we're really aggressive in moving to understand how we can help make sure that this is not a place that starts to really heat up, because there's so many vulnerable people there that we're really afraid that that could lead to, you know, to some problems with outcomes and hospitalizations and deaths. So particularly in the southern part of the state is an area that we're very interested in moving very early and quickly. And I'll hand it over to Dr. Slimp or to Secretary Crouch.
Yeah, thank you, Clay. This is Bill. Clay said it very well. What we're looking at doing constantly is mitigating risk, and we're doing that with our families, as the ones who are really close to this disease, as well as everyone in the state of West Virginia. It is difficult to know what's right during these times, but we do know this virus is not gone. This virus is still around. We all need to make sure that we protect ourselves and protect our families. Wear masks when you can. Social distance. We've talked about that over and over. Southern part of West Virginia, we've been watching and talking about every day for at least the past week. Very concerned. We have the Hatfield-McCoy Trail and hundreds of people coming in. So we want everyone down there in the southern part of the state to to do what they need to do to protect themselves as well. People coming in from out of state makes this much more difficult to contain. So again, we want everyone to be safe. As the governor says, you've done a terrific job, and we just want to keep that up a little while longer. So thank everyone.
All right, thank you, Taylor. Next, we'll go to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, everybody. This is a question about the virus coming back in the fall. There have been various forecasts that there may be a return of coronavirus or a spike in it when we get back in the fall. Maybe Dr. Marsh would be best for this one. As a weatherman, what is our chance of precipitation from a coronavirus coming back in the fall, and what would you advise people to do to prepare for that?
Clay, go.
All right. So thank you for the question. Certainly, we know that being outside is safer from a spread of COVID-19 than being inside. We also know that the ultraviolet light from the sun, not necessarily the heat, but the UV light seems to reduce the ability of the virus to spread quite as effectively. But as we've seen, 19 states, have demonstrated that the virus is still around and is going up in those states, and 9 states has shown that hospitalizations are going up even now. If we look at other parts of the country that are transitioning to a colder weather climate and look at countries like Brazil, Brazil's seen an amazing increase in the number of cases and now rates second in the world behind the US in the number of COVID positive people. So I think that we are at very great risk as a country and as a state as the weather turns and we become more inside based versus outside based, and as the UV light from the sun starts to fade some. So I think that's the reason why taking the precautions that the governor, that Secretary Crouch, that Dr. Slimp, that everybody, me, is trying to impart to be safe, which is really very simple. If we keep our distance from each other, we can still be around each other, but be a safe distance and wear a face covering or a mask and wash your hands. Then, as we've seen in Hong Kong, they kept their whole country absolutely open, never shut it down. And they've had 4 deaths so far, 4 deaths. In Sweden, a place that's about the same size, and even it's because Sweden's much bigger in the square mile area. There's fewer people per square mile in Sweden than Hong Kong, so Hong Kong should be much higher. Sweden is coming up on 5,000 deaths. So ultimately, by protecting ourselves and doing these very simple things consistently, all of us, then we will protect ourselves today and in the winter until we can get a vaccine or a drug treatment that starts to solve this problem in a more permanent way.
All right, Governor, I'll turn it back to you.
Okay, well, I've just got a couple points here to make and everything, and I sound like a broken record just a bit. We don't have really too many records out now, but for those of you who've got a few gray hair and everything, you'll remember the records. And but here's the bottom line, the whole thing. Everybody's got to know there's no perfect solution here. There's not. As we open up the next level of things, it is more exposure. We know that. And we know that this virus is right here with us right now. And all I can possibly tell you is just this. There is no playbook. There's no perfect playbook. We all know we got to go back to work. We all know we got to reopen. We all want that in every way. And all we continue to ask you is one thing, and that is please, please, please be safe, be smart, social distance, wear your mask. Do the things that are going to protect you. Now, so I want you to know that everyone here, all the experts, all the people in my administration, everybody is doing the very best thing that we can possibly do in watching the numbers, but Everybody here would tell you this: there is no playbook. There's no playbook to tell us exactly what to do. All we're doing is doing the very best we can possibly do and still enable you to be able to get back to a life as close to normal as we can. Now, I've got a couple other things. I mentioned compassionate care earlier, and that is, a loved one at a nursing home that is in really tough shape and is probably not going to be with us much longer. Please, all the nursing homes, and I know you're doing this already, but please remember to work with those. And the last thing on earth we want is someone to pass away and everything that we know is really, really in tough shape. And we got to find a way for their loved ones to be able to visit them. And so we've already had that. Those guidelines of compassionate care have already been in place. And they've been in our guidelines for a long time. And so, again, I urge the nursing homes to work with these people, and I know you are, so please continue to try to do so. And my last comment is on the Hatfields and McCoys Trail, because that's in really on top of everything is in my neck of the woods in West Virginia. Southern West Virginia, the Hatfield and McCoys Trail is surely in my neck of the woods there. And all I would do is urge everyone, when we started to reopen down there, just to tell it like it is, when we started to reopen down there, a lot of people really concerned, and they didn't really know if we could really take care of the people and keep everything, just as germ-free or as clean as we possibly can, and really on top of our game. Well, you've done so. You've done so, West Virginia, as I knew you would. I knew you would and everything, but I would urge you in every way, continue to do so, because we do have a bunch of people that are coming from out of state. They help us economically. We welcome them and everything else, but as far as all of our facilities and everything, or your discussions with those people, try to help them be good stewards of what we're trying to do, as well as really take care of the facilities, as I know you will, in a phenomenal way, and just keep doing that great work. The last thing I would tell you is just this. Dr. Marsh is exactly right. The sun helps us. The sun is helping us today. But West Virginia, don't go to sleep at the switch. Today, the sun shines 24 hours a day in Arizona. And if you're in Arizona today, you could fry an egg in your hand just standing outside. And Arizona's got a real problem. Florida has got a real problem. Can you imagine how hot it is in Florida today and everything? Well, Dr. Marsh said the heat doesn't matter too terribly much, but don't just because we have changed from rain and 45 degrees to the sun being out and 80 degrees, all of a sudden all of our problems are over. They're not over. They're not over, so just be safe, West Virginia. Keep on pumping out the good numbers. Keep on continue to show the world just how good you really are, and West Virginia is going to end up the place, the diamond in the rough that everybody's going to want to come to. Thank you so much.